Hey guys, today I am going to talk about anterior knee pain and the different types of anterior knee pain you can get. We've been seeing a lot of it in the clinic lately because it's obviously getting beautiful outside and it's our running season, and we've also got the Deep Physio run coming up on June 24th, 5, 10 and half marathons. So we're seeing a lot of little niggles coming in. Knee pain is one of the main things I see in runners. There's obviously a lot of other injuries, but today let's focus on the knee. First things first, and what I want to kind of talk about when it comes to the knee is the middleman to the ankle and the hip. So I will never directly just look at a knee problem without first assessing the ankle and then also assessing the hip. The same goes for, say, if I was with the shoulder, the elbow is the middleman to the wrist and the shoulder. So usually people will have elbow issues because there's something going on at those two joints, okay? So first things first, if someone's like, I have knee pain, what's the issue, where is it coming from? The first thing I always am looking at is I'm doing a full pelvic assessment and seeing how the weight is being transferred through the pelvis, what's the hip doing, and how is that translating the force down into the knee, and what's the ankle doing, and how's that foot and ankle driving up to the knee. So you can imagine anybody who's walking or running, if you have issues at the hip or the ankle, of course, it's going to give you a knee issue. So that is number one big takeaway that we all have to kind of look at, right? The other thing that I really notice in the body is that everything gets reversed to what it should be. So the reason I say that, and I'll explain a little bit more, is everybody should have a very mobile ankle. So your ankle needs to be, sadly on this one, we've got a lot of ligaments and tendons, so I can't move it up and down, but your ankle should have a lot of beautiful range of movement in that ankle. And obviously the foot is a whole mechanics in itself with pronation and supination. So we're not going to get into that today, but what I just want to address is we should have a mobile ankle. That then, as you come up the chain, you have a mobile ankle, you should have a stable knee joint. You need a stable knee joint to take the force through. We should have a nice mobile hip. Our hips get very stiff, but we should have a mobile hip. From sitting all day, bad posture, those hips can get very stiff. Pelvis and core, we all know that also needs to be extremely stable. Okay, so I'm just gonna stop right there. What we tend to find a lot of the time is that from sitting and poor posture a lot of the time, we will get a very tight and stiff hip, and our ankles actually get quite stiff as well if we're not stretching them out. Another thing that will cause ankle stiffness is repetitive little sprains or strains of the ankle that are not treated. If you've lost that range or it's changed the way you move your foot on the ground, that as well can completely change the way the forces are distributed up into the chain in walking or in running. So what we see is a stiff ankle, a stiff hip, usually the core and pelvis, or I would say the core is weaker. So what usually happens is then the knee also becomes very unstable. So looking at a runner, first thing I'm looking at is what's happening at the pelvis, what's the stability of the core, what's the hip mobility like, and what's the ankle mobility like. And that will give me a lot of information to what's happening at the knee. So when it comes to now anterior knee pain, thinking again of the hip and then the ankle, a lot of the muscles, meaning I guess the hamstring, but also more so the TFL and as well the rec-fem, which is a quadricep muscle, a more superficial quadricep muscle, attached to the pelvis, and they're a two joint muscle. So they act over the hip as well as over the knee. So what's happening here will also affect the knee. The quadricep muscles attach along the femur, and they come, there's the lateral, there's the intermedius, which is the middle, and then there's the medial one here. All three of those quadriceps come in and they attach and slot into that kneecap. They come over and then they insert via the patellar tendon on the tibial tuberosity right there. So again, when I'm looking at anterior knee pain, it's coming from the kneecap and where it's placed. The first place I'm gonna go is I'm gonna look, or one of the first places I should say that I'm gonna look, is what's happening at the hip, the quadriceps pulling down. Most of the time when we have this lateral knee pain, which also you Google it, you'll see runner's knee is usually the main one that we see, is that the lateral structures, the TFL muscle, which is the muscle, a tiny little muscle here that attaches into the IT band, which is that fascia along the outside of the leg that most runners go and roll, which again, I'm not gonna get into it, not the best thing to do, because again, it's coming from the muscle up here, comes and attaches and it onto the lateral aspect of the kneecap, right? So if this is really tight, well, of course, what's it gonna do? It's gonna pull the kneecap over laterally. What that kind of then starts to do is that it starts to switch off that medial quad. And the medial quad is the one that attaches on the inside, and obviously that's gonna give it the medial pull that way. So if you have a weaker medial quad and you have a really tight lateral structures going into the kneecap, it's going to pull that kneecap over to the side. So the way I explain is if you have your kneecap and it's sitting in those nice little grooves, if it's being pulled over, now you've got more bone on bone, right? And that's where you're gonna get the irritation, the inflammation, the pain. When we go and we squat down, that kneecap is pushed right into, and it should slot nicely into the groove. Well, if it's not sitting properly, it's gonna be bone on bone and it's gonna be painful. Hence why a lot of people have pain going up and down stairs, squatting, sit to stand, those types of things. Usually, if this is not a really chronic issue, we can fix it incredibly quickly by just regaining the balance of the quadricep muscles and of what's happening at the pelvis and of the ankle, and to bring that kneecap into situ and into a better place when they're walking or they're running. So that's more that lateral knee pain, which is the most that we end up seeing. Secondary to that, if it's going on for a long time, there's another one, if you Google it, it's called jumper's knee. That's more so the patellar tendon that starts to get irritated. But once again, it's all coming down to the same biomechanics of what the pull from the hip down to the knee, where that kneecap is being placed, and what is that strain on that tendon because it's not lined up properly. So the way we really treat that runner's, that anterior pain, runner's knee, jumper's knee, all of that type of stuff is really doing a biomechanical assessment, a functional assessment of, you know, how you're moving and how core, hip, knee, and ankle are working together as a unit, and then treating appropriately, and then giving you the proper corrective exercises to be able to get your body in a better position before you go load it in that running or that walking activity that you're doing. So biggest thing is though, at the end of the day, if you've got any little niggle, pinch, soreness whilst you're running, it goes away, but then it kind of comes back. Get it sorted, get it looked at, because it could be the easiest, quickest fix. And what happens is if you don't, these things turn chronic. It's like 6 weeks, and they could still be going on for quite some time and having to get a handle on them. So if you're wondering about knee pain in runners and in walkers, that's a little bit of my blurb. Okay guys, thanks, see ya.